Uterine fibroid is very common these days. A lot of women are having uterine fibroid. Please, if you're a lady, relax and consider watching this video to the end. And after watching, don't forget to share to that your lady friend that also needs to hear this, okay? Let's talk about some of the symptoms of uterine fibroid. Uterine fibroid is a tumor that is growing inside your uterus. It's a growth in your uterus. The actual cause is unknown, but it can be purely genetic. What do I mean by purely genetic? That means it can run in families. And another thing that can cause it is hormonal influence. Hormonal influence can also be a cause of uterine fibroid. That's not what you're talking about. I'm talking about strictly the symptoms of uterine fibroid. That is why I said if you're a lady, please consider watching this video to the end. What are the symptoms that a lady will have that she will suspect that she's having uterine fibroid? The first thing I'll talk about is heavy menstrual bleeding. You are bleeding for long duration, and this bleeding is coming with clotted blood. Clotted blood, I mean, it's coming with thick blood, and you are bleeding for a long duration, and you are bleeding heavily, and any bleeding that exceeds 7 days is abnormal, and your bleeding is exceeding 7 days, is lasting up to 10 days, 14 days, which is 2 weeks. That bleeding is abnormal. It could be a symptom of uterine fibroid. Please, you need to see your doctor. You need to see a gynecologist. When you are having abnormal bleeding, abnormal menstrual bleeding, your menses, they bleed heavily, please, you need to see a gynecologist, okay? Secondly, you having abdominal mass. You realize that your lower abdomen is becoming bigger and bigger. As the uterine masses, they are growing, your abdomen is becoming bigger. And sometimes you feel something moving in your abdomen. That could be a sign of uterine fibroid. 3, you are having extremely painful menstruation, painful menses, your menstrual cramps, very, very heavy, very painful, that you cannot even do anything for yourself. Once you are in your period, once you are menstruating, you cannot do anything for yourself. You're having extremely painful menstruation. That could be a sign of uterine fibroid. Painful sexual intercourse. Once you are knacking with your partner, you'll be having pains inside you. That could be a sign of uterine fibroid. Also, frequent urination, because as the uterine masses are growing, they are pressing the bladder, and the frequency at which you go to the bathroom to urinate will increase. Yes, that could be a sign of uterine fibroid. Frequent urination. Constipation can also be a sign of uterine fibroid. Sometimes you will realize that your legs are getting swollen. That could be a sign of uterine fibroid. Another symptom I'll talk about is miscarriage. Yes, fibroid have caused a lot of miscarriage because the growing baby did not see space to grow, and this fibroid is pressing the baby, causing a miscarriage. Okay, yes, fibroid can cause miscarriage. And another thing I'll talk about is infertility, but depending on the location, because it can block the passage of the tube, making the sperm not to reach the matured ovum, making your man yogurt not to reach the matured follicle. How can you treat fibroid? The treatment depends mainly if you're having symptoms or not, or also the size of the fibroid, and if you are also completed a family or thinking of starting a family. So your gynecologist will discuss all this with you and plan the best form of treatment for you, okay? And also take note of this. Please take note of this. Fibroid cannot be melted. I know a lot of you are taking some medication, taking herbal medication, taking this, taking all sorts of concoction just to melt fibroid. Fibroid cannot be melted. Have you seen an operated fibroid before? It's just like a stone. It cannot be, the film melts. So stop wasting money on buying different concoction, buying different medication to melt fibroid, because fibroid cannot be melted. The best thing for you to do is to go and see your gynecologist to plan a better treatment and a better form of treatment for you, okay? The best thing where you go do for yourself, if you're having fibroid, please go and see a gynecologist for a best plan of treatment, okay? If you continue to take those things where you take, they make her more bigger and more complicated. If you just start family, or you never start family at all, or you don't complete family, your gynecologist will discuss the best way for you to take, the best treatment for you to take. Stop taking all this concoction. It not go melt am. I'm telling you the plain truth. Fibroid does not melt. You are always making the situation more complicated. Just see a gynecologist, okay? I hope you find this video helpful. Don't forget to share to that lady friend of yours. Also share to that babe that needs to hear this. I am still Nurse UG, and I'm here for your elevation. Hit the follow button. I'll see you in my next video.